Thank you all for joining our first annual Read Boom Boom Sickle Cell Disease Awareness Campaign. We are so glad you guys joined us. We actually have an international panel representing Nigeria, United Kingdom, Canada, and of course, America. In a few minutes, I'm going to give an opportunity to the panelists to introduce themselves. But first, I want to just kind of highlight a book that brings an international panel together to raise awareness for sickle cell disease. The purpose of R.E.A.D's book in this campaign, R.E.A.D, and if someone will put the acronym R.E.A.D in the chat box so everyone is aware of what it is: raise awareness, encourage children to know their genotype, empower families with leadership skills to meet healthcare needs for those living with sickle cell disease, and activate a community and destroy the stigma for sickle cell disease. And remember, awareness and advocacy brings social change. So R.E.A.D, if you will, please introduce yourself. This is world-renowned author. If you will introduce yourself and read an insert from your book, please.
Yeah, hi, good afternoon, everyone. My name is R.E.A.D. I'm the author of Boom Boom, which is a book that espouses and, sheds light, puts a focus on sickle cell anemia. Thank you for this opportunity to connect with you over this topic and also to receive feedback, because I believe it's not only an interactive session, but it's also an opportunity for growth. Today, I'll be reading from chapter 9, The Wheels Begin to Turn. My dad carried R.E.A.D Boom Boom in his arms and ran into the hospital. She was now screaming, crying, and speaking one after the other. Daddy, make it stop. Then she would scream and continue. It hurts so bad, Daddy. Then she would break into tears. When my dad got into the room that had the words emergency department boldly written in letters that glowed, he made straight for the counter where there were 3 nurses. The rest of the room was filled with people who were sitting on benches and looking dull and unhappy. My daughter needs help. She's having a crisis. My dad was panting. Kompa and I had run in behind him and were now standing by his side. The nurses looked unbothered. It was as though they didn't see that R.E.A.D Boom Boom was crying in pain. Excuse me, I said my daughter needs help. My dad's voice rose higher. Please stop shouting, we are not deaf. A nurse with a big stomach shouted back at him. I'm sorry. Please, can she see a doctor? My dad asked. Can't you see other people waiting? The nurse said with irritation. Yes, I can, but she needs something for her pain. She has sickle cell anemia. My dad continued. His voice was low, as though he was sharing a secret with the nurse. Oh, one of those, she said with her nose raised with disdain as she looked down at R.E.A.D Boom Boom, who was twisting and turning in my dad's arms. Her cries were rising and falling with her movement. Can we see a doctor, please? My dad asked again. The doctors are busy. Have you been to this hospital before? She asked. No, we usually take her to our family doctor. So why don't you take her there? Because it is far from my house and she needs something to stop the pain immediately. This is a general hospital. There is nothing like immediately here. You have to pay to open a file for her, and then I will do all of that while she sees a doctor. Can't you see that she's in pain? My dad's voice was rising. She's not the only person in pain in this hospital. If you cannot wait, then take her to another hospital. I don't have time to argue this early in the morning, the nurse said, and sat down behind the counter. I could feel anger rise through me. I wanted to shout at the nurse, but because the counter was taller than me, I couldn't see the nurse's face anymore. I turned to the other nurse, who was writing on an open file on the counter. She was slim, tall, and bespectacled. Excuse me, ma, please, can you help my sister? She looked at me from the top of her eyeglasses for a moment. My dad and Kompa turned to look at her. R.E.A.D Boom Boom was groaning now. We don't allow dogs inside this hospital, she said with an even more stern voice than the nurse with the big stomach. Take your dog out of here. Kompa immediately broke into a run. He raced down the corridor away from the counter. The nurse looked at him in alarm. Stop your dog, she called out. Kompa, I called him. He didn't respond. Rather, he took a turn and disappeared from view. The slim nurse turned to my dad as the nurse with the big stomach stood up. "Sir, we don't want trouble. Go and get your dog before it bites somebody," the slim nurse said. "Compa will not bite anybody," I answered. "Daddy, my leg is hurting," Ege Boom Boom cried out. "Please get a doctor for my daughter," my dad said in a firmer voice. "Get your dog, take it out of here, fill the form, sit down and wait your turn. Please, she's in pain." "Didn't you hear what I just said?" the nurse with a big stomach responded in a high-pitched voice. Just then, a man emerged from the corridor and walked towards the counter. He was wearing a white lab coat and had a stethoscope hanging around his neck. A doctor. Compa was walking in front of him. When they got to the counter, the doctor immediately reached for Ege Boom Boom and held her arm gingerly. "So this is why you came to drag me out," he said, looking down at Compa. Compa stood there, his tongue hanging out as he panted, looking up at the doctor. The nurses looked at the doctor, and the one with the big stomach spoke. "We told them that dogs are not." The doctor interrupted her by speaking directly to my dad. "What's wrong with her?" "She's having a crisis, sickle cell anemia." I'll stop here. So that was from chapter 9, from the book Boom Boom, that espouses sickle cell anemia.
Thank you. How do you tell us just a thought right now on how you feel about this book bringing people from all over the world together to raise awareness for sickle cell disease?
Well, first off, I'm totally, honored, inspired to keep on giving more to the community, even though myself, I'm not a warrior myself, but I remember January last year, I had sat down to write this book, and I wrote it over 4 weeks, thereabouts, 4 loose weeks. And in writing, I could not have imagined that it would have gotten such traction and connected with so many people, and giving so many people the just what it's doing, the unction to come and join this fight to move the struggle against sickle cell anemia forward. So there is no gainsaying the fact that to be able to give of yourself and of your talent and of your vision and of your love to things that you are not actually even suffering from, I think it's something that just keeps on, it keeps on blowing your mind. It keeps on telling you that there's more that you can do, even as you stretch your hands to reach other people.
I totally agree. It's absolutely awesome. And so I don't want to keep going forward with you, Jude. I want to make sure we introduce everyone on the panel who has come together because of this book. So if you guys will, everyone on the panel, if you will take your, let's do one by one. So if you will introduce yourself, but when you do, tell us where you are in the world and your involvement with sickle cell disease. So Dr. Ife, we will start with you.
Good morning, everybody. My name is Dr. Ife Osunkwo, or Dr. Ifeyinwa Osunkwo. I'm actually in Charlotte, North Carolina in the US, but I'm originally from Imo State in Nigeria, a village called Arondizuogo. I'm a daughter of the soil, married to a man of the soil, and I'm delighted to be here. I take care of adults with sickle cell disease, and I'm trained as a physician to take care of both children and adults.
Thank you. I'm sorry. Thank you for that. And Funke, you are next.
Hi, everyone. I'm Funke Iluyamade. I live in Canada. I'm originally from Nigeria, like Dr. Ife. Why am I here? Basically, I'm a carer. My younger son has got sickle cell disease, so I'm a caregiver and and also an advocate for sickle cell as well.
Very good. Very good. Raul, if you will, please introduce yourself.
Hi, my name is R.E.A.D. I'm a sickle cell warrior. I am 52 years old. I am originally from Nigeria. I live in Atlanta, Georgia.
Thank you. Welcome, welcome. And Tunde, you are next,
Hi,
sir.
everybody. My name is Tunde Okeowo. I actually am in London, England at the moment in Hertfordshire. I'm a warrior. I've lived with sickle cell for going to 56 years, and I've got 4 strong kids who are doing very well without any sign of sickle cell in them.
Great. So this would be for those who may not know anything about sickle cell. If you will, everyone on the panel, take your phones off mute or your laptops or all those great things. And then we're just going to have a discussion. We're going to talk candidly, truthfully, transparently, all that great stuff. So if you will, let's do Iffy. Dr. Iffy, if you will share what sickle cell disease is.
So sickle cell disease is a genetic blood disease. You are born with blood cells that are shaped like bananas instead of little oranges, and they get stuck. As your blood is flowing through your body, these cells get stuck and they block your blood flow to different parts of your body. What happens with sickle cell disease, when you have this blockage of the blood flow, you end up having pain in your organs, your legs, your arms, your back, but it can also block blood flow to vital parts of your body like your brain. You can get a stroke, you can go blind, you can have heart problems, lung problems, liver, spleen problems, bone damage, any part of your body where blood flows. Sickle cell can actually cause blockage and damage to those organs. And because of that, people with sickle cell disease typically do not live a full life. They have a lot of pain, they suffer a lot, and they may not live as long as other people who are of their same ethnic background.
And then tell us about sickle cell trait, what the difference is.
So sickle cell trait is somebody who carries the gene of sickle cell disease, only one gene. To have sickle cell disease, you have to have two genes. So you get one from your mom, one from your dad, and if you have those two genes, you have sickle cell disease. Sickle cell trait, you have only one gene from one of your parents, and the other gene makes normal blood cells. So when you look at your genotype, you will have something they call AS, where more than 50% of the blood you make is A blood, and less than 50% is sickle blood.
How does someone know, what their genotype is?
You have to get a blood test. You have to get a test that tells you if you have sickle cell disease, or if you have sickle cell trait, or if you're not a carrier at all. So sickle cell trait is when you carry one gene. Sickle cell disease, you have two genes. And then if you have none of them, you're not a carrier, you have AA genotype.
Which means you're normal.
Yeah.
So you have normal hemoglobin. And so when are people tested for this? Like, is it at birth, or how will they know, if they have sickle cell disease or sickle cell trait?
So it depends on where you are in the world. In first world countries like the United States and Canada and Europe, you are tested when you're born. So when a baby is born, before they go home with the mom, that first 24 to 48 hours, they do a finger prick or a foot prick, and they do a blood test, and they send it off to the national lab. And usually within the first 10 to 14 days, the mother or the dad gets a call and says, your child has sickle cell disease, or your child has sickle cell trait, or your child does not have either the trait or the disease. In places like Africa, Nigeria, and other West African countries where sickle cell is even most common, we don't have newborn screening. We don't have a blood test that you do at birth. So you get tested when you begin to show signs of having sickle cell disease. And it's up to whether your parents take you to the lab, if they can afford to get the test. A lot of people have sickle cell disease in Africa and in South America and other parts of the world, and they don't even know they have it because there's no standard way of testing you. Now, the reason why we get the testing at birth is because infection, malaria, bacterial infection, viral infection are the main reasons why people with sickle cell disease pass away when they're 0 to 5 years of age. And so if you know they have sickle cell disease, you can do things to prevent them from having a really bad infection. So that's why newborn screening was started. And unfortunately, in Nigeria and in Africa, where there's a lot of malaria, we don't have newborn screening. So many thousands and thousands of babies die before they turn 5 because they die from malaria.
So, and I have so many questions regarding that. And I know one of the purposes is to raise awareness and then making sure everyone knows their genotype and then begin to minimize the number of people who could potentially have sickle cell disease. How do you do that if there's no newborn screening, if children aren't being tested? How does that work?
So that's a challenge. And I think because most of our audience is international, it depends on where you are. So if you're born in the States or in Europe or in London or Canada, you know your status by newborn screening. However, your mom may know your status, but when you turn 25 and you're trying to make a baby, you may not know what your mom knows. So we need to make sure that parents pass that information on to their children so that they know. Every adult should make it a point to know what their sickle cell status is, no matter where you live in the world. Either you get it when you're as a newborn, the test is done. So somewhere, somehow you can get that test done. If you can't get the test, you need to get another test and confirm. But if you're living in a third world country, like, so at places in Africa, and you don't have a newborn screening test, as an adult, you need to find out what your genotype is. You need to go to a reputable lab where they have the right equipment and the right testing situation, and you need to get that test done. Now, please be mindful that there are several 419 testing locations out there. You can get a test and they may give you a false result, and that may mislead you. So you want to make sure you go to a reputable lab where the testing is accurate. And then another thing that we do in Africa is we find out if there's a carrier place, is anybody in your family has sickle cell disease or sickle cell trait. I think that is part of why there's so much stigma, because people don't understand what being a carrier means. Having sickle cell trait doesn't mean that everybody in that family should not marry anybody else. It's a risk factor. You need to know your status and then let the partner you have know their status as well. And then you can make an informed decision. But I encourage everybody, whether you're a baby, an adult, anywhere in between, get that blood test to know what your sickle cell status is. To give you an idea of numbers, in the United States, there's 100,000 babies, there are 100,000 people with sickle cell disease in the entire US. In Africa, about 250,000 people are born every year with sickle cell disease. So 250,000 babies are born every year in the continent of Africa with sickle cell disease.
Wow.
Nigeria has the largest sickle cell population in the world. So it's not going to be hard to have a girlfriend or a boyfriend with sickle cell traits if you live in Nigeria or you're from the continent of Africa. So that's why you need to make sure that you know your status so that you can make an informed decision. You have to be able to make an educated decision about who you have a baby with, who you partner with as an adult.
So we're going to pivot in 1 second, but I want you to, and I don't want to say why, tell us some of the complications with sickle cell disease. So when we're telling people, hey, you need to know your genotype, tell us some of the complications, and you can, or not even complications, let's say challenges from birth until 100 years old. So just a few of them, just a few. And I'll say for myself, one thing when I first learned about sickle cell disease is the penicillin, twice a day until they're 5 years old. So tell us some of the challenges there, and then we're going to pivot.
So sickle cell disease, people think of it as it causes pain. And yes, it can cause pain, but not everybody with sickle cell has pain. Not everybody goes to the emergency room and ends up in the hospital. Pain is only one part of sickle cell disease. Sickle cell can cause damage to your organs with no pain at all. You may never have a pain crisis and have a stroke. And it may show up as difficulty with learning, severe headaches, vision problems, weakness of the side of your body, one arm and one leg, or you can't walk or you can't talk very well. Sickle cell can cause cardiac problems, heart problems, where you have shortness of breath. You cannot walk and do exercise like everybody else. You get really tired very easily. It can cause kidney damage where you end up on dialysis, but you've never had a pain crisis. It can cause leg ulcers. That's very common in Africa, where you have an ulcer on your leg, a wound that doesn't go away and is there for a very long time. And nobody knows why it's there. They don't even think about sickle cell disease, but it could be very well from sickle cell disease. It can make you not grow very well. Some kids with sickle cell disease are very short. They have stunted growth. They have poor nutrition. They may have difficulty with their liver. They can get gallstones where you have pain in your belly and you have stones blocking your gallbladder. You need to have surgery. Your spleen can get really big. You see, they have a very big stomach and their blood goes to their spleen and they get very tired. They can pass out. And it's something that can cause you to die with malaria because all your blood gets in your spleen and it breaks apart and you can't survive. So there's many different sickle cell type complications. It makes it harder to go to school. It makes it harder to hold on a full-time job because if you're always tired, you can't wake up on time, you may go to work late and they may fire you. Or if you had a stroke, it may be hard for you to learn. Not everybody has all the complications. Some people have one complication. Some people have no complication. Some people have some of this and some of that. It may be mild when you're young and may more severe when you get older. It may be very severe when you're young and get better when you get older. No two people with sickle cell look alike. They have a different sickle cell genotype. They may have a different sickle cell presentation, even with the same genotype. And there's a question in the chat that talks about what different types of sickle cell disease there are. There are at least 70 different types of sickle cell disease, 70. We know about 5 of them because they're the most common ones. Sickle cell SS, sickle cell SC, sickle cell beta thalassemia plus, sickle cell beta thalassemia 0, and sickle cell SD. These are all different types of sickle cell disease, but there are 70 different types. And you need to know that if you have SC, it is not the same thing as sickle cell trait. But back in the 70s and the 80s, when we were in medical school, we were taught that SC is the same as sickle cell trait, but it's not. It is sickle cell disease. And what happens with SC, you tend to have a lot of eye problems, joint problems, and spleen problems. So getting an education about sickle cell disease is very, very important, because if you have it, you need to know what type you have and what you need to watch out for. And if you have the traits, you need to understand what your risk factors are for having a child with sickle cell disease.
Thank you so much, Dr. Iffy. So we're going to switch. If you will, the warriors on the panel, if you will identify yourselves, and even you as well, Funke, as a caregiver and an advocate, if you want to share with us your genotype, and then also tell us your description of what a sickle cell warrior is. And we can start with you, Tunde.
I think Dr. Iffy has actually explained it in a more detailed way. I mean, I was born with SS. I lost a brother, I lost a sister, and out of 5 of us, 2 of us survived. Now, it's like she said, it's varies in terms of presentation. And I think she has answered it all.
Now, we had this conversation the other day about, you know, the advocacy, and we had talked specifically about warrior, what that means to you. So tell us, and that's the reason why I brought this up, because we had this conversation.
As a warrior, it's more of how you've learned to live with it. But one thing I can say to anybody listening to me is this: if you have sickle cell, the first thing you need to know is that because you have sickle cell doesn't mean you're going to die young. So if that is within you, and the choice you make is that I want to live, I want to be like somebody else. And that's what I have done throughout my life. I've always believed that if my friends could do something, I could do the same. When I was young, I do try and then end up in hospital. When I got older, I still tried and end up in hospital. But as I learned to understand what it is in terms of what I need to do, how I need to look after myself, I have made that choice that I want to live long. And I think that has been the driving factor that has kept me going on and on and on and on. But it's a long journey. It could be scary at times, because I could remember there was a time I thought I was going to go. I told my wife, practically, I'm tired. I am going. But because I have a very good network of great people around me, my sister, my wife, she will tell me, no, that's not the agreement we made. You can still go further. But where I am right now, I can tell you, I've made that choice within myself. I'm going to live long, and I'm going to live long.
Thank you. Raul? Tell us, Raul, if you want to share your genotype, and then also, what is your description of what a sickle cell warrior is?
My genotype is SS. A sickle cell warrior is someone who has this condition in their body. You know, it's like, I describe it as the vessel that I am traveling in this world with is flawed in a way. It operates on half tank, but I keep it moving. You know, I keep one foot in front of the other. I have had a lot of bone crises. I've had several surgeries. particularly with my digestion. I've had my gallbladder removed, which is not uncommon for people, just people generally. It's not particular to sickle cell. But what happened with sickle cell that affected me is I had something called hemolytic stones. So my body kept producing hemolytic stones and there was a constant blockage. So I've had to have a stent put in and taken out every 3 months. I had that over and over again. And that kind of like aggravates the sickle cell because, you know, any kind of infection, any kind of stress aggravates the body. But I have a saying that I will live till I die. So I don't just like, oh, because I have sickle cell, I'm going to cower down and, you know, wait for death. I'm just going to live my life and I'm going to enjoy my life to the fullest. I will not be reckless, but I will, you know, take care of myself, know my trigger points, know what precipitates crisis. And usually for me, it's cold, it's stress, it's dehydration. So I just pretty much make sure I hydrate myself, you know, in the cold weather. I bundle up, you know, and I try and minimize my stress. I try my best to avoid people that have infections because I'm susceptible to infections. But I have 2 daughters, 2 beautiful daughters. They're 20 and 24. So yeah, sickle cell is in my body, but sickle cell is not me.
So I love that statement you said, I will live till I die. So let's talk about this skydiving. You did. Share with us what brought you to that moment of it.
So skydiving is something that has been on my bucket list. I don't even know how it got there, but I just kind of felt like, you know, why not? Why not push the boundary? Why not, you know,
Did you talk to your doctor before you did that though?
No, I didn't.
That was one of those live till you die moments. I
didn't, but I did my due diligence. I did my research online. And then when I saw, I think it was a 92-year-old lady doing the skydiving. I'm like, a 92-year-old lady who had 2 men holding her till she got up into the plane could do it, then why can't I do it? And I just pretty much made sure that I, you know, hydrated myself. I wore long pants so that I would not get cold, but I didn't wear like a jacket or a hoodie because I thought it would be too hot up there, but actually I was wrong. When you get up there, it's really cold. So if you have sickle cell and you want to go to skydiving, make sure you wear long sleeves because the wind will really hit you and it's really cold up there. But it's fun.
What did it feel like?
Breathing so much air that I'm sure you're oxygenated all through.
Yeah, I don't think I will ever find out, but see Iffy fussing, Iffy saying something. I can't hear you, Iffy, Dr. Iffy.
Going to high altitude is a risk factor for having a sickle cell complication. So I'm glad it worked out for you, Raul, but I have to tell you, I have had patients who went to Galapagos Island, they went to Denver, Colorado, they were in a helicopter and it almost killed them. So again, when you research things online, please research things that have to do with sickle cell disease, not AA people. Anybody with AA who's 110 years old can go skydiving and they'll be fine. But please don't take risk with sickle cell disease that apply to sickle cell disease, but people who don't have sickle cell disease are gonna be okay. I wanna make sure people are educated appropriately. There's a lot of stuff about doing these type of sports in AA patients, but not in sickle cell disease and not even in sickle cell trait. This year alone, I've had 3 sickle cell trait patients who traveled to Denver and some South American high mountain area, and they had to have surgery to remove their spleen when they came back.
This is trait.
I do believe you because I went to Colorado, Keystone, Colorado, and within 24 hours, I was in hospital because my oxygen saturation was lower than 80%. So yeah, I do understand that.
Yeah, so again, people need to get information about sickle cell and not the general population to apply to themselves.
Thank you, Dr. Iffy and Raul and Funke. If you will, please share us a little bit about your son living with sickle cell disease, and then how the both of you are warriors, and specifically speak to the advocacy piece for us.
Okay, so thanks, Azizi. First, I want to address Rao, that yes, Sisi Rao, she is daring, so I'm not surprised she went skydiving. And then I'll address something about the oxygen as well later in what I'm going to say. So my son was about 5 months old, because by the time he was born, the new screening in Canada I think came about a year after he was born. But when he was about 5 years old, I noticed that his eyes were kind of yellowing. And I'm thinking, does this child have jaundice and everything? So quickly, and I'm thinking, okay, the traits and all that, let's get him tested. So we got him tested, and within, I think, a couple of days, that's when we found out that he had the sickle cell disease. What we've done, what my husband and I have done, is that we've been advocates for him along through the whole journey. He's 15 years old now, ensuring that whatever the doctors say to us, there for his appointments and all. What we have here is when they're a certain age, we have regular appointments, and then as they get older, it's like every 4 months. And then also we address going onto the spleen. When I was told that he will have to have penicillin for his spleen, I asked, okay, why do we need to give him penicillin until he's 5 years old? Then understanding about the complications, and understand that if he doesn't, about the blood and everything with the spleen, that he could lose his spleen. And then we started that with him when he was young until he was 5. My son has never had pain crisis. As Dr. Ify said, no two patients are alike. He's never had a pain crisis, which I'm grateful for, because I know I've seen what it can be. But what we noticed from his regular checkups, which they do, like I mentioned, on a regular basis, that we found that he had a heart murmur. So that's where the complication came in for him, was the heart murmur. So he has an enlarged heart, because his heart is doing more of the work that the lungs were doing, because he had a bit of asthma, which has come out from as well. So we do our regular checkups once a year for the heart. And then he's also in hydroxyurea, which he started taking in 2012, because he did have infections, which would land him in the hospital. Not a pain crisis, but because of infections, he would land in the hospital. And there were a particular, I think 2 occasions whereby we just couldn't get rid of the infection. So he had to take blood transfusions. So the last time he took blood transfusion was in 2012, and that's when we started the hydroxyurea. And thankfully, he hasn't been in the hospital or had any infections, anything issues since then. But like I said, because it's on hydroxyurea, we do go for the checkups every 4 or 5 months to make sure he's on the right dosage. And we do blood works in between, which they send to call it sick kids here. We send it off to send to sick kids to make sure that the dosage is still working. And but another thing that we've taught our son is, apart from us being your advocate, like for instance, at work, I would say, I have a son who has this condition, it's an invisible disease, so I need to go to hospital sometimes. Sometimes I might be called from school, I need to come pick up my son, so I will need to leave. So I made sure that my employers were aware of that. We also made sure the schools were aware of that. And if we found out that they didn't get it, sick kids being the sick kids hospital will come in and speak to the school to give them information, or they send handouts, etc. I also would speak to the school that he might need to take medication, etc. Give them all that information. So we've also taught so in that way, being the advocate, as well as teaching our son to be his own advocate, to be able to speak up, to make sure that he looks after his body. Understand where, if there's any pain, understand your body properly, know why you're taking the medication, take it regularly. So we've also trained him to be responsible in taking his medication. So I don't have to say, you need to take your medication. He now takes his medication on a regular basis on his own without me having to prompt him. And basically another thing that we do with him is ensure that he, like Rao mentioned, he's hydrated on a regular basis, but also ensure that he doesn't put junk food in his body. We try to ensure that he lives clean in terms of healthy eating. That is another thing that we push for him all the time. So I don't know if I've answered all your questions. You're on mute. You're on mute.
Oh my gosh. Okay, there we go. So sorry, but no, you did answer the questions. And actually, I want to have a follow-up question for Raul and Tunde on how important is it for someone to advocate for you during a crisis? And then also, how can we do a better job as a community, as a world, to advocate for sickle cell?
I think I'll let Raul go first.
Okay, thank you, Tunde. To advocate for me, in a crisis, if I'm in hospital, you know, my family are my best advocate. But I also advocate for myself because doctors, nurses, they see people with sickle cell, but they don't see me. I mean, they don't always see me. They don't know me. So I am my best advocate. I know myself. I know what medication I would take. I know what agrees with my body, and so does my family. So, you know, they're able to speak out for me. At work, I kind of like don't disclose that I have sickle cell at the beginning, just because I don't want people to think, oh, she's going to be lazy or blah, blah, blah. She's going to look for excuses. I just do my job. And I'm hardworking, so that shows through. But so if I do get into a crisis and then they understand that, okay, she is in a crisis, she's not just, you know, calling in sick for, you know, having a nice weekend or something, or being drunk or whatever. So I advocate for myself by letting people know that I have sickle cell and but I don't announce it. I don't say, oh, I'm a sickle, you know, I'm a sickler. I don't like that tag.
Right, right.
Yeah.
So
I think I agree with you on that one. Go on, Aziz.
No, Tunde, it's you. Go ahead.
Okay. Now, when you talk about advocating for you're the best advocate for yourself. One thing is this, even in England at the moment, there's still a lot of naivety in terms of different kinds of sickle cell anemia cases. We have what we call pain nurses. Having grown over a period of time, you know what kind of medication you need, you know what kind of dosage you need. But what I realized was that at about 10 years ago, they brought in what they call pain nurses. So the nurse would say, oh no, you can't take that amount of painkiller. And then I had to let them understand that I've lived with this thing. You have not lived with it. And you don't see me in the hospital all the time. So you have to understand what I'm saying. Then also, in moments where I can't even talk or I can't even say anything, I'm like I said to you the last time, I married a pharmacist. So my wife is very, very good at telling them, first, I'm a pharmacist. I know what it goes through. This is what it needs. This is what it needs. We also need to do more of what you're doing now, because I still believe that people still believe that sickle cell people are kind of weird people. I know I'm a very hardworking person, so I surprise people when all of a sudden, maybe in the next, I might be around you now doing things and enjoying myself. Then all of a sudden I have a crisis. People look at you, what's wrong with it? What do you mean crisis? We are together just now. Because crisis doesn't tell you when it's going to come. Although at times you feel the symptoms of pain coming. But we need to talk out more. There are a lot of ideologies and belief that don't give them this kind of medication. They will get addicted to it. I agree, some people do get addicted to it. But I was a rare breed of person that only want to be in hospital for 4 days. After 4 days, I want to be out of hospital. And the way I did that was having a wife that understands what I was going through. When I'm leaving hospital, I'm telling them I want to get out of hospital. When I get home, even though I've not fully recovered, she knows what to do. And I think that's why the network of people around you need to be knowledgeable about what you're going through. Then when you can't talk, they will talk for you.
Yeah, I completely agree with that, Tunde. So just listening to you and Raul, and this would be across the panel, let's talk about some of the stigmas associated with sickle cell disease. And Dr. Iffy, you can speak to the health-related stigmas as well. So it doesn't matter who, Funke, if you want to lead with one or two of the stigmas, and then we'll allow, because I actually read in the chat room, the chat box, where someone said that sickle cell patients are, and this is a stigma, deemed as drug seekers. So that's one. What are some of the other ones?
So the drug seekers one, as well as lazy, because there's that laziness and, oh, they're going to die. Don't worry, they're going to die soon. Sorry, I had to bring that up. But that's the stigma as well. That's what in some of our countries, that's what comes to mind, first of all, forgetting that you can live a wholesome life. You can, and like we had this discussion before, that there was a 94-year-old woman in Nigeria. I mean, I think she passed this year, but she lived up to 90 and she enjoyed her life. And Dr. Ife has talked about somebody who's 70, and then I think there's somebody else who's 98. So there are possibilities. It's just ensuring that you are your advocate, you know your body, and then the people around you too are your advocates. And they know that if you can't talk, that they are going to step up for you, but also living that wholesome life at the same time. Because sometimes when we have that negativity in our minds, it can lead to that negativity, and that negativity can come to fruition. It's like what Tunde said about being positive in everything. So the stigma, I would say, is about early death, the drug seeking thing, and then being lazy.
Are there others? Jude, in your research, did you come across any stigmas for sickle cell related?
Myself, yeah. Yes, I did come across that, just in addition to what has been said. But in Nigeria, which is pretty unique, there's a spiritual angle to it, where they say, these children are obanjes, they go and they come, and you have to appease the gods to make them stay, and all of that. Then, of course, the stigma of love, which is a very, it's trying, because in as much as we go ahead and we say, hey, check your genotype, if you are AS, if you have the carrier trait, be conscious of the kind of marriage decisions you take. But then when you look at the flip side of the coin and you say, but what about the people who already have the disorder, the sickle cell disorder? What about them in the terms of having a wholesome love life, wholesome marriage and all of that? So when you see parents and siblings, the way they look at the person coming into the family or coming into the relationship, that sickle cell person, don't even think about it. And they even say it to these people's faces.
That's right.
You know what I mean? So you see a lot of loneliness in that community, as it has to do with choosing life partners and being in relationships and all of that. So even though we are advocating to stop sickle cell, the disorder, we also have to be aware of what the challenges of the day-to-day living is for the people who already have it, or the people who carry the traits and all of that. So that I'll just put that as two, but I think
I'm going to agree with you on that, because when I was going to get married, my brother-in-law went to my wife and said, are you okay? This guy's skinny. This guy looks sick. This guy is already not going to make it. And my wife said, yeah, I've made up my mind. I'm going to marry him. Then he went ahead again and spoke to my father-in-law. And I thank God for my father, blessed memories. He's not around with us now. He called my wife from Nigeria and said, this is what your brother said. Do you want to go ahead with this guy? This is what we know about people with sickle cell. This is what you're going to possibly go through. He might not even make it. Are you prepared to? And my wife said, yes, I was. So when my wife said, yes, I am sorry, my father-in-law said, okay, that's it, let's go. And I'm grateful. I mean, 27 years since we've been married now, in November. I am still here. Like I said to you, I'm still going to live long. So let's live this life. We've got to.
Wow, that's actually powerful to hear.
Can I piggyback on that?
Absolutely, Raul.
Yes, so I have a friend that always tells me, because I'm actually morbid. As much as I live life, I'm also morbid. But a friend of mine tells me, oh, you are going to outlive us all, the way you're going. And, I believe it, as long as we have that will to live, we will, put that out in the universe, and one way or the other, fingers crossed we'll make it. But talking about marriage, Tunde is so blessed. He has a wonderful wife who supports him. I, on the other hand, was not that lucky. And my ex-husband actually referred to our marriage as a sickle marriage. So that goes with stigma of how people look at sickle cell, or people address sickle cell. So one thing I know I do is, I don't like to be a burden on people when I'm sick. So I hide my pain a lot, and today's nodding, because I think, that's a common thing for us sickle cell warriors. We don't want people to think we're weak We don't want people to think we're drug seeking, you know. I have bottles of old medications that I threw away after a while because I don't take them. I get my body to fight. And I thank my father for that, who was a medical doctor. Growing up, I wasn't given the highest pain meds. I was taught to fight the pain, to use my mind, you know, to pray. You know, I am not just a sickle cell warrior, I'm also a prayer warrior. So, you know, putting both together, I believe has helped me. And today can attest to that because he's also a prayer warrior.
Has anyone ever said that you were drug seeking?
Oh, yes.
Oh,
I was too. Can I give an example?
In the hospital, we have nurses.
I went to Bulgaria, and then Bulgaria hadn't joined the EU, and I had a crisis. And my wife was trying everything to see whether I would beat the crisis. And this was a pastor's convention I went for. So it's shameful to announce that this guy is sick. So we're trying. Then I realized that I was losing my strength. I couldn't breathe. So we had to go to the hospital. When we got to the hospital and I told them the kind of medication I'm on, the first thing they said to me was that this guy's a junkie. And don't get this wrong. In that time that we went, I was the only Black person. So they were not used to seeing a Black guy, and then this Black guy is telling them, this is the medication I need. It was only when I told them that I want to speak to the consulate office that they realized, okay, he's British. We can't afford to mess up. Whatever injection they gave me, I don't know. My wife will tell you. I was just running around the hospital for 30 minutes until I got knocked off. Up till today, I don't know what that injection was. But people see you that way.
So this is for you and Raul. What does a pain crisis feel like? Like, describe that. So everyone knows, like, when you're saying pain, you know, we think, oh, if I fall down and scrape my knee, that's pain. But tell us specifically what it is.
I think I want to go first on this.
Yeah.
When I saw this book, Read Boom Boom, I said, wow, that is a perfect name, because boom, boom is kind of like what you feel in your body, wherever the pain is. It's like someone is taking a hammer and it's just going on and on, boom, 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 in different areas. And if you're a woman that has had labor and has had children, I want to say sickle cell pain is worse than labor pain. Jeez. Period.
Period.
Well, I remember when you were having your first baby, you were in crisis and you didn't know you were even in labor. It's I will never forget. I only get serious. My crisis only gets serious when it gets to my back, and I can't breathe. If it's my legs and my arms, I'm still okay. But the moment it gets to my chest and my back, I have to be in hospital. But at that time, I remember you very well. You were in labor. You didn't even know you were in labor, and that tells it all.
Has anyone broken a bone like you or Tunde, Raul? Tunde, have you guys broken a bone? I know you said you had your gallbladder removed. So is a sickle cell crisis worse than the recovery from gallbladder removal surgery?
I don't understand the question.
So like just the healing process of having surgery, is a crisis worse than that?
Oh, yeah. When I have surgery, sometimes when I come out of anesthesia, I come out into a crisis. So, I mean, most of the surgeries I've had are like day surgeries where I end up in hospital for like 3, 4, or 5 days.
Yeah, I've heard patients say that a sickle cell crisis is worse than a fractured leg. Or I know a patient who was shot with a gun before, and he said that a crisis is worse than a gunshot wound. So that's why I always try to get patients to describe what that pain is, because sometimes we don't, when they say on a scale of 1 to 10, what's your pain level, and you.
I laugh at that question.
Right, because you want to say 1,000,000, but 1 to 10 doesn't describe being worse than a gunshot wound or worse than a hammer, banging against your bones. It doesn't speak to that, right? So let me ask you guys this: is there a cure for sickle cell disease?
Yeah, there is. I mean, the doctor can attest to it more, but it's more of like the stem cells treatment. But as
oh, there she is. Hey,
Dr. Ife.
okay.
So I love the question because I hear a lot of warriors say things like, I'm waiting for the cure, or we need to fight so that we can get a cure someday. The first cure for sickle cell disease was a bone marrow transplant in 1984. And the patient had leukemia, and the transplant was for the leukemia, but it cured the sickle cell and then cured the leukemia. And so we've had a cure for almost, I don't know, 20, 30 years. We're making it better and better. We're making it more available to more and more people. So right in the beginning, you could only get a transplant to cure your sickle cell if you had a brother or a sister who was from the same mom and dad, and the bone marrow was a perfect match. That was the best way and the only way to get a cure. Now we have figured out ways of doing a cure where your mom or your dad can donate for you. So we only need a 50% match. And the results are actually getting pretty good, to the point of 70% of a cure rate. And then we have this newer types of cure that are out there called the gene therapy, where you don't even need a donor. You can just get yourself. They put you on a research study. They take your bone marrow, take it to the lab. They manipulate it, fix the DNA defect, give it back to you, and then you begin to make non-sickle cell blood that doesn't cause the sickle cell problems. It's called gene therapy. There's many different types of gene therapy or stem cell therapy that are out there that are now getting better and better. So there is a cure for sickle cell disease. And I put in the chat, there are 6 treatments approved for sickle cell disease right now in 2020. Hydroxyurea is the first one. It was approved in 1998. And R.E.A.D is the second one. It was approved in 2017. And then last year, we got 2 new drugs called Oxbryta and Adakveo. And they were approved in November of last year. But even before hydroxyurea, even before these other new drugs, the use of transfusions has been very, very well done for sickle cell disease to treat the complications and to prevent things like stroke. And then the bone marrow transplant has been around for, like I said, since the 1980s. So there is a way to treat your sickle cell disease, and there's also a way to cure the sickle cell disease. Now, the newer treatments for sickle cell disease, or the newer ways of curing the disease, only happen when we do research. And it's called clinical trials. So we have to do studies or research studies where you take the standard, which is hydroxyurea or transfusions, and you compare them with something that is new and different. And so when you think about the cure, we know that a brother and a sister match is the standard way of curing the disease. We got to compare that with the mother and the father, the 50% match, and then compare that with the gene therapy. So part of what we are asking our warriors is, if we want to get new treatments for sickle cell disease, you have to participate in research that gets us new treatments for sickle cell disease. They will not test a cure for sickle cell disease in someone who doesn't have sickle cell disease. It doesn't make any sense to do that. It has to be done in somebody with sickle cell disease. And so part of what we need to, when we talk about raising awareness, is raising awareness about the disease, the diagnosis, the treatments, and opportunities to improve treatments by being a part of research for sickle cell disease. And there's different types of research. It's not only about a drug or a new intervention. It may be about getting information from you. How does sickle cell disease affect you? We did a survey across the entire world asking about sickle cell disease and how it affects your life in a way that is so organized so that we can now send it to people so that they can understand. It's called the Sickle Cell World Assessment Survey, or SWAY. And we learned from you guys about how bad sickle cell is and how it affects you going to school, keeping a job, getting married, doing your chores, education. I mean, I don't think that the medical community understood what you guys say in these forums if it's not presented in a way that's called research. So that study had about 2,100 patients. It's the largest in the entire world that's been done. It was in 6 different continents and 21 countries. So it was a lot of people with sickle cell disease. I mean, people didn't know that you had people with sickle cell disease in Iceland or in Australia or in Italy and in France. Americans think it's only in America. Well, there's a lot of sickle cell disease in Africa, in Benin Republic, in Tanzania. So learning about all of that, we need you to give us the information, and that's done under the guise of research.
Thank you so much.
Can I add to what Dr. Ify said? And then
Absolutely.
you can, if you, I mean, this is for everyone on the audience. If you do have, when you ask your doctors will be able to give you that information as well, that what research is going on. Because when we go for our appointments, we're asked, do we want to be part of this research? So the doctors will be a good place to start if you want to find out about research.
I have a question, Dr. Ify.
Yes.
Yes, so 3 years ago, I tried to get onto the stem cells treatment, and I went through the whole evaluation. My brothers, my kids, everyone was, DNA was tested, and my daughter was my best match. And then last minute, they said to me, I wasn't a good candidate because I did not have enough acute chest syndrome. So why is that?
It depends on what protocol they're looking at you for. So this is a part that's very confusing. There's different research protocols or studies that cure sickle cell disease. Some of them are for people who've had a stroke. Some of them will not allow you if you haven't had a stroke. Some of them are looking to see how sick you are. And if you're not too sick, you can do it. Or if you're too sick, you can't do it. And every hospital, every university, every institution they don't do all the studies. So if your hospital wasn't doing that was only doing that study, there probably is a study that you qualify for, but it may not be in Atlanta at your institution. There's a website called clinicaltrials.gov. Clinicaltrials.gov. I'm going to have the tech put it in the chat, that you can go to and you can find all the research that is being done in sickle cell disease. I had a woman who came to me in Atlanta and said, my 2 kids have SC and there's never anything for them. I want you to open up this trial here so that my child can be a part of it. I didn't even know the study was out there. So I went on clinicaltrials.gov. I'm like, oh, there's a study for SC. That was the first one I'd ever known for SC. Normally everything is for SS and thalassemia. So we opened it at Emory when I was at Emory, and she put her 2 children on that study. So you have to also advocate with your hospital and your doctors to bring to the sites those studies that are important to you. Because normally what happens, if I hear about a study from the research meetings I go to, I bring it to my hospital. But if I don't hear about it, or if nobody asks me about it, I wouldn't even know. None of us can know everything. But clinicaltrials.gov is a repository for everything research everywhere in this world. So you can type in sickle cell and you're going to get everything that is there for sickle cell disease. You can put in acute chest syndrome or pain crisis, and it will show you what you're eligible for. And I would encourage you to take it to your study, your team, and say, look, I want to be a part of this study. Make it happen for me. That woman, I will remember her. It didn't take that long for me to open up the study. I just didn't even know it was there. So she said, I see it, it's that they do it in Baltimore. I want you to bring it over here. And we opened it in Emory, and her 2 children were able to benefit. And I'm telling you that when she did the study, her kids did so well that when the study ended, they stayed on that treatment. And I think they probably are like in their teenage years, they're like 9 and 7. Now they're like teenagers and they're doing very well. And so I would never have been able to help her children if she didn't bring that to my attention.
So I told you we were not going to have time. We're not going to have any problems with, with time. So we are actually at the 11 o'clock mark, and we're going to start answering some of the questions from the audience. First question is, a particular genotype called SC, hemoglobin SC, tends to exhibit the sickle cell trait. What awareness can be given? And of course, Dr. Ify, I'm going to let you lead with that response.
So when I was in medical school in 1987, we were taught that sickle cell SC was sickle cell trait. That's the degree of knowledge we had back then. And that is a colossal lie from the pit of hell. Sickle cell SC is not sickle cell trait. It is one of the 70 plus types of sickle cell disease. So remember, if you do not have hemoglobin A or normal hemoglobin, that is more than 50% of your blood, you have sickle cell disease. So there's a disease called hemoglobin S thalassemia plus. They have about 20% hemoglobin A, not up to 50%. That is also a type of sickle cell disease. So the first thing you need to do is make sure that you have the right diagnosis. Is it SC, sickle cell disease, or is it AS, sickle cell trait? There's other types of traits. So AC is C trait. There's A thalassemia, which is thalassemia trait. There's AD, which is D trait. Any kind of trait that mixes with sickle cell trait will give you sickle cell disease. So it's not the trait, it is a disease. Now with SC, a lot of times they don't get sick when they're babies. They get sick when they're 20, 30, 40 years old. And it's a shock because they've never had a problem, never had pain, they didn't have any gallstones, they weren't jaundice, they were tall, they grow to be 6'5". I mean, my SC patients, they played football in college, they played basketball in high school and college, and then all of a sudden they get very sick. And they think, oh my God, what happened? But they've always had it. It just has a delayed presentation. So the first thing is to know what type of sickle cell do you have? What is your true genotype? That's the first thing that you need to know.
Is there a specific test for that, Dr. Iffy?
It's called the hemoglobin electrophoresis. Sickle Dex. There's a test called the Sickle Dex that was done back in the day. That's how we learned about medicine in the 80s and the 70s. Sickle Dex is looking at your blood by eyeballing it and saying, do I see sickle cells on the smear? If I see it, then you have sickle cell disease. If I don't see it, then you don't. That was the old way, and it was a very crude and elementary way of diagnosing sickle cell disease. Now there's a test called the hemoglobin electrophoresis. And what it does is that they actually calculate and they number how much of your blood is A blood, S blood, C blood, or other type of blood. So you get a number. You have S is 89%, and your fetal is 15%. Then I know you have sickle cell SS. You may have S is 99%, or you may have S is only 35%, and the rest is A. That's sickle cell trait. So they have to quantify the number of different types of blood you have in your body. It's called the hemoglobin phoresis.
Thank you, Dr. Iffy. So the next question I'm going to ask Jude and Tunde to respond to. Question is, in a place like Nigeria, where faith tends to play a major role on how health challenges are tackled, with some people saying you can marry an AS if you have AS, and by the grace of God, we will have children who are not SS. How do you address this situation?
Okay, I'll go first, Tunde, if you don't mind. Okay, that was, there were two things that made me, of course, write about focus on sickle cell anemia. One of them was that. I have a friend in Canada who used to stay with me, and he has a trait, the AS trait. And his mom got this girl in Nigeria. You know, they do a lot of matchmaking across the seas. And he came to Nigeria, found out she was AS. He wanted to go ahead with the marriage. And everybody in Canada, his friends, were concerned. And they were like, you know, you can't go ahead with this and all. But he was a Bible-believing, tongue-speaking, demon-defeating kind of Christian. And he said, no, God is not going to create that kind of situation for him. God will, whatever. But he went ahead with the marriage. They have two girls. Both of them have they have SS. They have the actual sickle cell disorder. Yeah. And he's been praying about it over time, but it hasn't changed. When I was in Toronto the last time, one of them the older daughter had a crisis, and she was at sick kids, what I think I was speaking about. And she kept crying, and she was saying, Daddy, why me? And he kept saying, oh, God knows best, God's going to stop it, and all of that. And meanwhile, he's a pharmacist himself. And so sometimes it just blows your mind that even people, just like what Tunde says, his wife knows about it and she can add value. But meanwhile, you see other medical or health care workers whose religiosity has superseded their training, that they perpetuate the propagation of the condition or they mismanage it. So instead of them to seek for medical help, they seek for spiritual help and just perpetuate the pain. And as you know, when it's not managed, obviously you can imagine what the prognosis will be like. So yes, in Nigeria is prevalent. You go to churches where they claim they can cure people with sickle cell anemia. Then you see the fraudsters, just like what Dr. Ife said, people who claim they have sickle cell anemia and they don't have sickle cell anemia. They use them for stagecraft. They bring them to churches, tell them to climb the stage and raise their hand and say, I was born with sickle cell and all of that stuff. And people contribute money. The other day, I put up a lady who had sickle cell anemia. Sorry, let me just quickly round up. She had sickle cell anemia. She reached out to me on Facebook and she said she wanted to x-ray something for her leg and she needed some money. So by the time I saw it, it was pretty late and I responded and I said, okay, send me an account number so I can send money to you. But because I get a lot of messages, I somehow lost track because I couldn't remember her name. So I went on my Facebook post and I said, look, you are out there, you asked for help. I asked you for your bank account number. I don't know if you've responded. Can you respond back to me? And this gentleman comes and claims to be this lady. Totally claims that he was the one who emailed me and all of that. And before I could intervene, people were sending money to this guy. Oh, so it's a crazy world out there where people who actually have the condition are losing help because other buccaneers or pirates are hijacking the situation. And then the religious community that is perpetuating it, even though some of them are trying to actually stop the propagation. So yeah, it's neither here nor there, but it's something that it's important to highlight. Tunde, please.
I think it's changing at the moment. I mean, being a pastor myself, most churches would not marry people now if you don't bring a certification about your genotype. I think that is helping to reduce that from happening as it used to be. My own case is a rare one. I have 4 children born in the United Kingdom. Like Dr. Ife said, every time you have a child, they check you for this. I have 4 children. I've never got a call from the hospital one day to say any of my children are traits. It still amazes me because my daughter went to Nigeria and was in a good school and they had to do a test on them. And because the doctor, knowing me, knowing my background, went ahead and checked their genotype. To his amazement, there was not anything called the sickle cell trait in that. Now, up till now, I can't explain that to anybody. And I don't know what has happened there, but I can only say that is a miracle. My last born plays football, competitive football. He will be a pro next year. Never one day in hospital. The other 3, never one day in hospital. So, like Dr. Ife said, maybe the check we need to go for is look at the various levels of the genotype so that we can know where they are. But at the moment, as I'm talking to you, never one day have we had a call from the hospital to tell us that any of our children has the trait. And that is very rare in the United Kingdom.
Dr. Ife, did you want to respond?
Yes, and so I think this is a common challenge. There's 2 things I want to point out here is that newborn screening is an imperfect system because ideally, every baby's test, the parent should get the result, even if it's not sickle cell disease. In many places in the world, they will only call you if you have sickle cell disease. Yes. Because of how they have to staff, there's needs a lot of money and staffing to be able to follow everybody. But they will only call you with sickle cell disease, but they need to call you with sickle cell traits. So that's the first take-home message there. And so what I tell people, if you never heard from them, you better call them. Ask your pediatrician to find you your results and put it in the baby's medical record. Second thing is, do we have the right diagnosis? Depending on what type of test was done, remember I said there's different types of sickle cell disease. There's sickle cell beta thalassemia, either beta 0 or beta plus thalassemia. In sickle cell beta thalassemia, you have 1 sickle cell gene and 1 beta thalassemia gene. So think about the beta thalassemia gene as either it's a sleeping gene that doesn't do anything, beta 0, or it's a very weak gene that only makes a little bit of A hemoglobin. So my suggestion a lot is that you should double check with your doctor to give you your genotype, because your children probably have a regular A gene and a beta thalassemia gene. That is the way to explain why they don't come up with sickle cell trait. Because if you were SS, you probably would have had all your kids would have the trait, because they had to get it from you. But it happens so, I cannot even tell you how many times, especially if you're over the age of 25, your test for sickle cell disease was probably done the crude way, and you may not have picked up those nuances. And it doesn't really matter for you, but it matters for the children, because if your child gets married to somebody with sickle cell traits and they have beta thalassemia traits, they can have a child with sickle cell beta thalassemia when they have a baby. So it's important that everybody understands their genotype and get the real answer. So if you were tested before 1990, 1995, when the testing was not really very accurate, I would almost say go ahead and get another test, because you want to know what type of sickle cell you have. Is it SS? Is it S beta 0 thalassemia or S beta plus thalassemia? Many things can be, you know, when you have very little pain with sickle cell disease and they say you're SS, two things can happen. Either you have sickle cell SS and a high fetal hemoglobin, or you have S beta plus thalassemia, and somebody just didn't do the right test. If you have a lot of pain, you most likely may be S beta 0 thalassemia, where you have that lazy gene that doesn't make any blood cells, and you only are surviving on the work of one gene. So again, it's, you have the right diagnosis, and everybody, if you know it, your children should know what they are.
Yes.
Because if they don't know what they are, then they're exposed thinking that they're fine. I mean, I had a family, they got married in Nigeria. You know, they said the test was negative, and then it was positive, and then it was negative again, and then they prayed about it. And then they had a son with sickle cell disease, and he was so sick. He was so sick. And you know how many Nigerians we do? We're going to pray. And I'm like, you know, like Jude said, I'm a born again, spirit filled, tongue talking, demon chasing Christian, right? I've seen people who are blind get their sight back. I've seen miracles in medicine that I cannot explain. So I believe in miracles. But I also know that God put me on this earth for a reason. Yes. Right? Science is here for a reason. And so you cannot ignore science and believe that faith is going to solve all your problems. If you know your diagnosis, then there's a reason why God made you know what you have. And I don't believe in being afraid. I believe in faith and hope. And my message to sickle cell disease is faith and hope. But don't be dumb. Wisdom, faith, and hope is what we need to exercise. And all of us should have wisdom, faith, and hope. My husband's cousin is a pastor. He has 3 children, and I never knew. He never told me his kids have sickle cell disease. Until 2 years ago, the other son was like, Auntie, aren't you a doctor? My brother is sick. Why? Well, how can we help him? And I'm like, you have sickle cell. I'm a sickle cell doctor. You live in America, and I can't help you. How embarrassing is that? Now, he's doing well, but it took a lot of work to get him on a treatment plan. I mean, I was calling Azizi for therapy because it was driving me crazy. Why would you allow your child to suffer when you have resources around that can help you? Using medicine for headache is not, it doesn't mean you don't have faith.
That's right.
Going to the doctor doesn't mean you don't have faith. Getting education does not mean you don't have faith. And so let's not put our head in the sand and live in the 1920s when we're in 2020. Wisdom, if you know better, you do better. Even the Bible says, my people perish because of lack of wisdom. Don't only apply that when it's time to make money. Apply that to your health and your wellness and taking care of your children and every part of your life. So let's not perish anymore. Nigeria is a country that is so wealthy in a lot of different ways, but we have so much poverty when it comes to knowledge, wisdom, and education. So your charge today, if you've been on this session, is to please use your wisdom, get education, and use that to guide what you do, not because of fear, but with faith. If you mix faith and wisdom, you get the best of both worlds.
Yes.
So,
Ola, did I preach good?
You did good. Tunde, she did good. I'm gonna amen her for that one. So Dr. Iffy, since you are talking, you actually have 2 questions that I want you to respond to really quickly because we are running out of time. So how can you find out how, so the question is, how can you find out the compatibility between genotypes? That's one question. And then how true is the saying that people with AA are more susceptible to malaria than those with AS?
So I'm going to start with the second question. There's a genetic, if you have sickle cell trait, the malaria parasite cannot survive for very long inside your red blood cell. So how do people get sick from malaria? They get the mosquito bite, it goes into the blood, it goes into the red blood cells, it sits there, it begins to multiply, and then it spreads all over the body, causes fever, heart, liver, kidney damage, and all the things that malaria causes. When you have sickle cell traits, the acidity of inside the red blood cell is not compatible with the malaria parasite. So many people with sickle cell traits are protected from malaria, but it's not 100%. If you have enough malaria mosquito bites, you can still get malaria with sickle cell trait, but it's protective. So compared to AA, you are less likely to get malaria with sickle cell traits than if you had AA. So that's a fact. Now, people with sickle cell disease don't have that protection. If you get malaria, it can really make you very, very sick. And then people with AA don't have that protection. Now, going to the other question was about how do you know the compatibility? Well, if you have sickle cell disease and you have a baby, you are going to give one of your genes to your child. So sickle cell disease means you have two genes that are not normal. You're going to give your child either an S gene or whatever other gene you have. If your wife has sickle cell trait, she's going to give her genes to her children too. So either going to be the A gene, which is the normal gene, or the sickle cell gene, which is the S gene. So if you think about it, if you have a child with sickle, if you have sickle cell disease and you have a baby with somebody with sickle cell trait, every time you have a baby, every pregnancy, there is going to be a 25 to 50% chance of having a sickle cell disease child. The only way you will not have a sickle cell disease child is if you have sickle cell disease and you have a baby with AA. That's the only combination that avoids having a child with sickle cell disease. So, and it doesn't matter if it's sickle cell trait or C trait or D trait or thalassemia trait. If you have sickle cell disease and you marry somebody with any of those traits, you can have a child with sickle cell disease. And I think it may be helpful if we put in a infographic on how the numbers look and send it to everybody on the call. Admin can do that later. There's a very simple picture that shows how to do how to figure out the compatibility. We can send that to everybody. But the only way to avoid a child with sickle cell disease is to have a baby with somebody with AA, who is not sickle cell trait or not any other kind of trait.
So we are down to like our last 11 minutes, and I told you guys we start on time, end on time. So I'm going to just kind of throw out some questions really quickly, and I'm going to give you like 10, 15 seconds to respond, right? So they didn't insert this as a question, but Dr. Iffy, I want you to speak to this really quickly. Death by the age of 21.
Not true anymore. It used to be true. It really used to be true, but not true anymore. When I see people right now, I say, I want you to live to be 99 years old, lose all your teeth, and use a walker.
What's your oldest patient? How old is your oldest patient?
79, almost going to be 80.
Nice. Yes, and we know several people live in their 60s and 70s. So, okay, next question says, so a person can live for years without knowing that he or she carries sickle cell disease, right?
Sickle cell trait doesn't have any symptoms. So you can have the trait and not even know it until you're 100 years old. You can have sickle cell disease and not know it either. I had a woman who I diagnosed at 74. She never had a pain crisis, so she never thought she had sickle cell disease. And the doctors didn't think she had sickle cell disease because she never had a pain crisis. She had the eye problem, gallbladder, spleen, and joint damage, but had never, ever, ever been to the emergency room.
I am scrolling through your questions really quick. The question, will these chats be sent as part of the communication? Yes, I believe we are going to send out the questions and the responses. How much time do we have? 10 minutes, which is really great. When, let's see, hi, could you, Gotcha. So let me just ask my question. What do you say to other sickle cell patients who, and this is not just for you, Dr. Iffy, this would be for the whole panel. What do you say to other sickle cell patients who may not be a voice or advocating for sickle cell disease? How can they get involved, or what should they do to, raise awareness for sickle cell disease?
We joke around in America about this phrase called "you snooze, you lose." If you have a condition that is a disparities condition, stigma, people don't treat you right, you have a lot less resources. If you don't speak up, if you don't advocate, you will never get it to be better. And you cannot wait for the doctor or the medical community to do that for you. People respond when they hear people who are living with the condition fighting for improved services, improved resources, and improved awareness. So you have to wake up and do something. Even if you talk to one person who doesn't know, that's moving the needle forward.
Right. So there is a question here. It says, speak on how we can better advocates for sickle cell. So let's see, was it Funke?
I mean, there's so many ways. I mean, for my child, for instance, like I said, when I'm there for his appointments, I ask the doctor questions, and I actually ask my son to ask questions as well. What are things, why are we taking this? What is it going to do for my body? Same things about, like I mentioned, at work, I do the same thing whereby if I need to go out for appointments is everything. And I kind of educate them on what the disease is. Funny thing is, one of my last contracts, I had a lady from the UK who was the sponsor of that project. And I mentioned it to her. I said, oh, I know what that is. The royal family had that many years, many moons ago. I said, really? And so I did my own research, but it was something else where it was a blood disease. So it's like one person at a time. Get that person educated in whichever way you can. And then that becomes, you start impacting the community. Be in your schools, whatever it is, just speak to one person at a time and speak your truth about what's going on. That's what I would say.
I totally agree with that. As an advocate myself, you have to know the disease that you are advocating for. So you have to learn sickle cell. And I'm grateful for Dr. Iffy over the years, just kind of pouring into me, so that has made me a stronger advocate for those living with sickle cell. So we are actually winding down.
So I just want to add, Ngozi mentioned something about SC foundations. That's another way. Yes, there are sickle cell foundations, organizations in every country, in every province, in every state. You can go through them as well to become a volunteer, awareness ambassador, whatever, an advocate.
Okay, can I just say
that?
Okay. Azizi, can I say something quickly to that?
Yes, please, yes.
Okay, so to advocate for yourself also, one thing I would like to point out that people might not know is the ADA, which is the American Disability Act, also advocates for us. So if you let your company know that you have the condition, you can get accommodations made for you. And I have actually benefited from that, because while I'm doing my doctorate degree, I actually got the ADA so that I can submit my my assignments maybe 2 days later than everybody else, because sometimes I'm in hospital. So having the ADA accommodation helps a lot.
Yeah, can I just add to that? For me as Judy Dada, I am AA. I don't have the trait. My sisters, my brothers, nobody I know in my family has a trait, but I still engage in the fight for it. I still wrote Boom Boom. I still give a portion of the proceeds to the Sickle Cell Foundation and all of that. I'm saying this for people out there, that you don't need to suffer it. You don't need to even know someone who suffers it. Sickle Cell Foundation is right there in front of Luth. There are so many foundations, fighting for sickle cell in Nigeria. This is the epicenter. This is ground zero of sickle cell. In your workplace, in church, wherever you are, speak for it. Help people. There are people who are indigent, people who are poor, malnourished, who their children are dying just because of inability to get funds. So you can help. You can do something. You can give money. We're always giving money out, but just do a little bit more research. As they say, Google, find out the closest charity close to you. Go to the hospitals. ask for words that they have sickle cell patients and just help. Just give a little bit of yourself to end this, will I say, this blight that is affecting a lot of people.
So we are down to our last 4 minutes. And so I want the panel to just simply respond, maybe take 20, 30 seconds. And this is the response I want you to give. I want you to respond to how the book that Jude has written, Boom Boom, share your thoughts on the inspiration, especially to the community, the sickle cell community, and then also share with us if there are any additional events that you may be participating in coming up that we can support. So those 2 things, and we are going to close it out.
Okay,
Who wants to go first?
I can go
Yes.
first. Okay, I don't have any other campaign or whatever going on right now, but I read the book. I mean, immediately I got the book, I couldn't put it down. Actually, I was texting Winifred, say, hey, I can't sleep because I'm reading this book. It's inspiring. It actually it actually takes you into the story, into each person's character, and you actually feel the character. So I would suggest that, yes, get it, because it speaks about the experience, not just the patient's experience, but the family as well, what they go through in terms of supporting a warrior as well.
Who's next? Tunde, did you want to respond?
I want to really say I appreciate the effort, and this is just the beginning of many. In fact, I'm going to get in touch with him because I'm 56 and I've given myself 4 years to stay in the United Kingdom because I want to go back and push for the awareness of sickle cell anemia. There is currently research that's been done in Nigeria. There's a supplement called Dioscovite. I have been on Dioscovite for over 11 years, and that's partly why I've not been in hospital. My wife was in Nigeria last year, and it's been confirmed that of all the researches they've done, that is the most effective supplement at treating sickle cell. But the problem is that an average person can't afford it. And that's part of the reason why I'm going back there, look at other researches they've done and push for it through the help of people, as many as I can get, to make sure that we give life to as many people as we can.
Great. And Raul, if you will.
Yes, I would just like to say thank you so much for this opportunity. Thank you, Jude, for writing this book. I ordered my copy like 3 weeks ago and it still hasn't arrived. So I wanted to have read it before today, but I guess I'll still get to read it. Thank you, everyone. Thank you, Dr. Ife. Thank you, Azizi. Thank you, Winifred, for putting this together. And the fight continues. We will do it.
Sure does.
And
yeah,
Dr.
for
Ife,
me, let me just quickly, before Dr. Ife, since you rounded up, just a quick one. What I'm doing for myself is I am going out there to get a lot of people to, because I've done, I've pushed the books, I've gone for book readings in school. Because one of the things that occurred to me why I wrote Boom Boom was I said to myself, are we speaking to people about sickle cell anemia at the wrong time? In terms of just about to get married, when they're blinded by love and they cannot hear. So I decided to write a book for children so that if the child has this information at 8, 9, 10, 11, by the time they get to that kind of age where they're taking those decisions, it's just normal, it's already there. So what I've been doing, I've been going to schools and I've been reading the book, talking about sickle cell anemia. I'm still doing that. I'm hoping that I get more corporate sponsorship to buy more of the books so I can give it to these students for free. So those are the things I'm going to be doing once the lockdown has ended and COVID has gone away. I'll still go out there and I'll spread the message.
are you doing anything virtually that we can support you?
I am not a very tech person, but the people who are tech savvy are telling me that they can help me do something. So I'll totally let you know.
Yeah, just to add to what Jude has said, I totally agree that it starts from a young age, and it's not just once, it's repetitive. You keep on mentioning it over and over again so that we can sink in. It's true, it starts at a young age in terms of sharing the information.
Oh, definitely. I told my daughters about sickle cell when they were like 3, 4, 5 years old. Once they could understand, it's like, yeah.
So, and I'm going to say something really quick before I allow Dr. Iffy to say closing remarks. Just in regards to the treatment that Tunde had mentioned, I always say, make sure you go back to your primary care doctor and your hematologist and talk with them first before you start any treatment. Dr. Iffy, if you will.
So I want to just say thank you to Winifred Ayeri for organizing this, and also for everybody on the tech team. You guys did a great job. All the attendees, I know it's like 6 hours behind us in Africa, so thank you for spending the time. You know, Jude, awesome, awesome book. I think what really struck me with the book was the emergency room experience, when the child and the father and the boy went to the emergency room. And I wish I could say that that never happens in some parts of the world, but I can't say that. And my dream is that at some point in our lifetime, that will never happen again. So how do we get there? We get there by doing more of things like this. It's gonna take all of us, not just those with sickle cell, but those without sickle cell. It's gonna take Black folks, white folks, and everything in between to really let people know that every life is important, every life is valuable, every life matters. And that, you know, having a disease that is so silent, we need people to speak about it. And so it starts with us speaking about it, those people who are affected, those of us that treat the disease, family members, but don't be afraid to talk to your coworker who is Caucasian. It doesn't, everybody needs to be pulled in. You know, we just published a report by the National Academy of Science, Engineering, and Medicine that looked at the overall outlook for sickle cell disease, and it was really scary. But it did come out with some recommendations, and recommendation is the need for robust, multifaceted, multi-pronged public health awareness in every domain, not just in private life, public life, academic life, healthcare, government, pharmaceutical industries. Everybody needs to know and everybody needs to be aware. And so we're going to ask that those of you who are on the audience, if you can commit to doing one thing, just one, the 51 members of this audience, tell somebody who doesn't know about sickle cell disease in the next 1 week before the end of September. If 51 people tell 51 people, and then you tell them to tell 51 people, that's now 153 people who didn't know about sickle cell disease who have now heard it within the next 10 days. So our ask is that you tell one more person, have you heard? Oh, go to this recording, buy this book, listen and learn about sickle cell disease. That's how it kind of gets spread. The same way that the coronavirus is spread by contact, let's spread the word about sickle cell disease, but it's not an infection, it's a hope message. Thank you guys so much. I really appreciate being on this panel. And Azizi,
Thank you.
Great job.
Thank you everyone. Thank you, Azizi.
Absolutely. So thank you all so much. This was our first annual, and we're looking forward to 100 more. We are going to end this. However, before we do, I am going to read this. It was a part of Jude's post the other day, and then we are going to conclude. We are 4 minutes over time, but Jude, he wrote, we have to dedicate ourselves to issues that matter, even if it does not directly affect us or the ones we care about. We have to care truly and actively. And I love that statement. So that is our mission and our purpose, to just be that change in the voice for those living with sickle cell disease. We love you and thank you guys so much for joining, and we will see you next year.